Yes. Good evening, all of you. Good evening. Hope all are doing good and fine. It's me again, Abhilash Vijay Mohanan Nair, faculty from B-GHUD on this virtual platform. Hope all are doing good and fine, keeping healthy, safe and ഫൈൻ. ഓക്കെ. സോ ഇപ്പോൾ എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നു എന്നൊക്കെ വിചാരിക്കുന്നു. അപ്പോൾ നമ്മുടെ 9th ലൈവ് സെഷനിലേക്ക് നമ്മൾ വന്നിരിക്കുകയാണ്. ഷിഞ്ചു, ഹലോ. ഹലോ മനെ. നീതു മരിയ, ഗുഡ് ഈവനിങ്. ഷിഞ്ചു, ഗുഡ് ആഫ്റ്റർനൂൺ മനെ. ഓക്കെ, സോ ദർ ഈസ് അഗെയിൻ അനദർ കൺഫ്യൂഷൻ ലൈക്ക് ഗുഡ് ഈവനിങ് ഓർ ഗുഡ് ആഫ്റ്റർനൂൺ, ബോത്ത് ആർ അക്സെപ്റ്റബിൾ. ഓക്കെ, സോ നോ പ്രോബ്ലം, ഒന്നും വിഷമിക്കേണ്ട. ആഫ്റ്റർനൂൺ ആണെങ്കിലും ഈവനിങ് ആണെങ്കിലും ലെറ്റ് ഇറ്റ് ബി എ പ്ലസൻറ്റ് ടൈം, ലെറ്റ് ബി എ പ്ലസൻറ്റ് ടൈം വെയർ വി കുഡ് ചെറിഷ് ദിസ് വിർച്വൽ പ്ലാറ്റ്ഫോം classes. Okay, അപ്പോൾ നമ്മൾ sir, my speaking score is 380. very good മക്കളെ, very good. I am very happy, Shinju. So congratulations, all the very best for your future endeavors. I want you to come up with more blessings and more all those prosperities. May God the Almighty shower his blessings upon you to fly into weathering heights with multicolors. അപ്പോൾ എല്ലാ സന്തോഷങ്ങളും സമാധാനങ്ങളും മക്കളെ ജീവിതത്തിലെ ആഗ്രഹങ്ങളെല്ലാം സാധിക്കാൻ ഭഗവാൻ അനുഗ്രഹിക്കട്ടെ ഷിഞ്ചു. അപ്പം അങ്ങനെ സോ ബൈ നെക്സ്റ്റ് ഇയർ ദിസ് ടൈം മേ ഗോഡ് ദ ഓൾമൈറ്റി ഷവർ ഹിസ് ബ്ലെസ്സിങ്സ് അപ്പോൺ യു ടു എൻജോയ് വെരി സ്നോയി വൈറ്റ് ക്രിസ്മസ് ആൻഡ് ഹാപ്പി ന്യൂ ഇയർ. ഓക്കെ, വെരി പ്ലസൻറ്റ് ടൈം. ഓക്കെ, അപ്പോൾ അടുത്ത വർഷം ഇതുപോലെ സമയത്ത് നല്ലൊരു സ്നോയി വൈറ്റ് ക്രിസ്മസും ന്യൂ ഇയറും അതുപോലെ തന്നെ ഒരു പ്ലസൻറ്റ് ടൈമും ആഘോഷിക്കാൻ സർവശക്തനായ ദൈവം തുണയ്ക്കട്ടെ എന്ന് പ്രാർത്ഥിക്കുന്നു. മൈ പ്രേയേഴ്സ് ഫോർ ഓൾ മൈ ഡിയർ സ്റ്റുഡൻസ് ഹു ആർ വാച്ചിങ് മീ. ജെനി, ഗുഡ് ഈവനിങ് മനെ. ഷാരോൺ, ഗുഡ് ഈവനിങ്. സോ എല്ലാവരും, സോ മേക്ക് ഷുവർ that you people are watching this video. I know that this time is quite difficult for most of our students or aspirants to attend, but you can watch it later, you can save it, you can watch it later. Anyway, this telecast will be there in the virtual platform line, both YouTube and Facebook channel. We have got this recording, virtual platform recording will be there. You can watch that. I want all my dear aspirants, my dear students, those who are watching this, to save this, to keep watch this, like this. I want, most importantly, please do extend your support by showing me the suggestions. You could pin your comments, you could pin your suggestions inside the comment box. Okay, Jayalakshmi, hello mane. Shinju, all the best mane. Hello. Okay, so please do give me the suggestions. I want you to interact during this session so that I could also make this time more entertaining. Okay, if you are giving me some questions, if you are throwing some questions or your doubts or concerns or queries, it would be more easy for me to have a comfortable discussion. അപ്പോൾ നിങ്ങൾ ചോദിക്കുന്ന ഡൗട്ട്സും മറ്റു കാര്യങ്ങളും ഒക്കെ ഉണ്ടെങ്കിൽ എനിക്ക് ഇച്ചിരൂടെ സന്തോഷമായിരിക്കും, എനിക്ക് ഇച്ചിരൂടെ അത് മോട്ടിവേറ്റിംഗ്. ദാറ്റ് വുഡ് ബി എ സോർട്ട് ഓഫ് അപ്രീസിയേഷൻ ഫോർ മീ whenever if you crack me some sort of doubts or queries. Please do pin your comments. Okay, suggestions there in that comment box. And if you have got any queries, we are getting many questions, we are getting many queries, and I always make it as a point to discuss all those things in this upcoming classes. Okay, അപ്പോൾ നിങ്ങൾ അയച്ചു തരുന്ന ക്വസ്റ്റ്യൻസും ക്വയറീസും ഒക്കെ മനെ അവർ ക്വാളിറ്റി അസസ്മെൻറ്റ് വിങ് ഈസ് ദെയർ, they are just forwarding it to me. So I'll make it sure that I'll make it as a point to discuss all those things in this upcoming classes. Okay, അപ്പോൾ ഇനിയും വരുന്ന ക്ലാസ്സുകളിലും നിങ്ങളുടെ സജഷൻസിനനുസരിച്ച് മുമ്പോട്ട് പോകുവാൻ എനിക്ക് പറ്റും. So please do watch this, comment on this session. You could give me your suggestions. Hello Reshma Mane, hello. So you can give me the comments. Okay, please do share it and share it with those who are needy. Okay, so many are eagerly waiting, many are waiting to get their dreams come true. So I want all my dear students to share it with your friends. Okay, so please do watch this and make use of this session. Okay, so we'll be discussing all those most important topics that you feel like a burden or that you feel like hard to crack. Okay, നമുക്ക് OET സ്പീക്കിങ്ങിൽ വേണ്ടിയിട്ടുള്ള ഇച്ചിരി പ്രയാസമായിട്ടുള്ള ക്വസ്റ്റ്യൻസ് ഒക്കെയാണ് നമ്മൾ കൂടുതലും ഡിസ്കസ് ചെയ്യുന്നത്. I have just given you all the different models. You can have a watch on that previous sessions. കഴിഞ്ഞ ക്ലാസ്സുകളെല്ലാം നന്നായിട്ട് നിങ്ങൾ വാച്ച് ചെയ്യുക. So you'll get a good idea on how to deal with different topics of various nature. Okay, പല ടോപ്പിക്കുകൾ, പല നേച്ചറിലുള്ള പല ടോപ്പിക്കുകൾ നമുക്ക് എങ്ങനെ ഡീൽ ചെയ്യാമെന്ന് നമുക്ക് ആ പഴയ വീഡിയോസ് മീൻസ് നമ്മുടെ പ്രീവിയസ് അപ്ലോഡിങ്സ് ഒക്കെ കണ്ടു കഴിഞ്ഞാൽ നിങ്ങൾക്ക് മനസ്സിലാകും. ഓക്കെ, ലീഡിയ, ഹൈ, ഹാപ്പി ടു സീ യു Aries, New Zealand, thanks for your support. Lydia, I am extremely very happy. So this evening, so energy boosters, through your words I'm getting this boosters, I'm getting this energy boosters. I'm very happy that you are there in your dream destination. My prayers for you for all your future endeavors. God bless you, Makla. God bless you abundantly, and don't forget, do remember me also in your prayers. നിങ്ങളുടെ പ്രാർത്ഥനയിലും ഞങ്ങളെ എല്ലാവരെയും ഉൾപ്പെടുത്തുക മക്കളെ. I'm very happy. I'm very happy to have this sort of okay, comments from my student side. Thank you all, thank you. പിന്നെ എന്തെങ്കിലുമൊക്കെ വിശേഷങ്ങളൊക്കെ നിങ്ങൾക്ക് ഇതിനകത്ത് ഷെയർ ചെയ്യാം. ഓക്കെ, നിങ്ങളുടെ സന്തോഷങ്ങളും സമാധാനങ്ങളും ഒക്കെ നമുക്കിവിടെ ഷെയർ ചെയ്യണം. അപ്പോൾ അതാകുമ്പോൾ ഇൻ്ററാക്ഷൻ വിൽ ബി ദെയർ പോസിബിൾ. ഓക്കെ, അപ്പോൾ നമുക്ക് ഇൻ്ററാക്റ്റീവായിട്ട് തന്നെ നമുക്ക് നമ്മുടെ സെഷൻസിനെ കൊണ്ടുപോകാം. ഇൻ്ററാക്റ്റീവ് സെഷൻസ് ആർ ഓൾവേസ് we could enjoy those interactive sessions. If I'm giving you continuous lecture, it would be probably the most boring one. I don't want that to happen like that. So I need all of you to give me some anyway some good news, or anyway you are like you could share me your good things and all. Okay, so that others will also get motivated by your words. Fine. Okay, so again I just forgot to give an introduction to my gang, my crew members who are supporting me. I would like to thank indebtedly to my dear Vibin and dear Jobin. Okay, they are making this session possible. They are working very hard. See, I'm just giving you the lecture every day, every time on all these virtual platform sessions. I'm giving you the same community. It's actually quite tough to make this session possible because there are a lot of technical works has to be done. Okay, works have to be done. So it is through their brain only these things are running. So extremely I'm very glad with them. I thank my dear Vibin and Jobin for making this session possible. So they are actually making this possible. They are bringing this class to you. Okay, Abhilash is giving only the lecture. Actually it is because of them this session is possible. So once again, thank you all who all are supporting me. I would like to thank to my B-GHUD family for making this session possible, because lots and lots of students are making use of this sessions. I'm very sure, because we are getting queries, we are getting this watch reviews like that. Okay, so Boni, hello Mane, good evening, hope you're doing good. Amrita, good evening Mane. See, sometimes I'm just taking this, my eyes are moving from this panel, okay, this board. Fine. അപ്പോൾ നമ്മൾ ഇനി നമ്മുടെ സെഷനിലേക്ക് കടക്കുമ്പോൾ നമ്മൾ സെഷനിലേക്ക് പോവുകയാണ്. സോ ഇഫ് യു ഹാവ് എനി ഡൗട്ട്സ് ഓർ ഇഫ് യു ഫീൽ ലൈക്ക് ഡിസ്കസിങ് സംതിങ്, പ്ലീസ് ടു പുട്ട് യുവർ ക്വയറീസ് ദെയർ ഇൻ ദാറ്റ് കമൻറ്റ് ബോക്സ്. നിങ്ങൾക്ക് എന്തെങ്കിലും കാര്യങ്ങൾ വേണമെന്നുണ്ടെങ്കിൽ, ഏതെങ്കിലും കാര്യങ്ങൾ ഡിസ്കസ് ചെയ്യണമെന്നുണ്ടെങ്കിൽ പ്ലീസ് നിങ്ങൾക്ക് കമൻറ്റ് ബോക്സിൽ ഇടാം. അപ്പോൾ അറ്റ്ലീസ്റ്റ് 1-2 ക്വസ്റ്റ്യൻ എങ്കിലും ഉണ്ടെങ്കിൽ എനിക്ക് സന്തോഷമായിട്ട് മുമ്പോട്ട് പോകാൻ പറ്റും. സോ എനി ഡൗട്ട്സ് ഓർ എനി കമൻറ്റ്സ് മീൻസ് പ്ലീസ് ജസ്റ്റ് ടെൽ മീ, so that first we will be having some general query discussions. Okay, some general discussion on OET speaking. I'll be giving you some, because previously and all we'll be starting sentences, gratitude expression, everything we were discussing. Okay, now on, so I've got a certain topic for discussion. So after that we will be moving to our role play discussion. Okay, so any doubts or any queries means Maklai, please do put your suggestions there. Okay, so I'll wait for a few seconds. If I am getting any question from your side, after discussing that I'll move to my part. Yes, my dear students, any doubts? No one is there for giving me a doubt. All are very clear about OET speaking and yes. Okay. So yes, well fine. So now we are going to start the OET discussion. First I'm going to give you certain sentences, certain question structures. Now we'll be giving you certain question structures on asking about the location of the problem. Okay, so when it comes to assessment, when it comes to this interaction with the patient of first time, we will be asking about this location of the problem. Okay, actually if the patient has got pain or any other sort of complaints, we will be asking their problem. Okay, we'll be asking them to locate the problem. So now I'll be giving you certain question structures that could help you in fetching. Okay, so you can deal with some sort of different question structures where you can use it in your role plays. So some sort of different things, okay, some different question structures to ask how to question this location of the problem. Okay, hello Rija Mane, good evening. Linu, good evening Maklai. Indu, good evening, good evening, good evening. So I have got a comment from, please get me the phone. Thank you. Okay, Mane, Dr. Sonia, hello, good evening. Ritu, good evening, good evening. If I buy B-GHUD online course. Okay, Mane, Jaiswal, BK Jaiswal, do you teach in English? See, I am using English mostly. Sometimes I will be slipping towards this Malayalam, but most of the time I will be using, so we are taking our classes completely in English language. You can confidently purchase our online course. Okay, there is no doubt. I am very sure that you will be definitely enjoying and making use of our online classes. Please do contact our officials. We will be pinning you the numbers. We will give you our number, the query number will be pinned there. You can have an access through that. Okay, so don't worry about anything. You will be getting your classes completely in English, and if you have got any queries, we are all time ready to sort it out. Okay, so BK Jaiswal, please do contact our query wing, and you can definitely enjoy, you can make use of, you can make the sessions will be worthy, and you can definitely make use of those sessions. Okay, and through this our virtual platform or online courses or offline courses, you can make your dreams come true. Okay, please do join fast. Okay, okay, Sonia, I'm speaking in English. What is making you what is the trouble? Please please tell me what is making you difficulty in following. What is that? Okay, doctor, you're from Punjab, I understand. So wherever you feel like something, I'm moving away from this thing, please make me know. I'll be there ready to deal with all your problems. Okay, so that I'll be mostly dealing my classes in English. I'll be giving you explanations, lectures in English. So please don't worry. In midst, I'll be slipping to this Malayalam. Excuse me for that. Okay, so please do get me your comments. Okay, hello sir, please suggest about speaking and reading. Okay, you'll be getting a reading session exclusively. Now we are conducting this session exclusively for speaking. For reading, definitely you'll come with another one session. So now this session is planned for speaking, because of our students' request. It is per the queries of the students, and it is because of their suggestions. They have sent me some questions, so we are dealing with that. Okay, Sonia, definitely I will consider your request for reading. We will be conducting another one session. Okay. Yes, Mane, good evening, Kaveri. Gigi, I'm also happy to hear calling Mone to us. See, for a teacher, always his or her students are just like children. I feel like always my students are like my children. That sort of love, care and affection a teacher should show towards. A good teacher can act as parents, friends, good friends, and also for me, that is why Maklai I am calling Mone. It is not, that is coming from my mind. Okay, so I am very happy, Gigi, you are getting happy because of my words. Yes. Okay, Mane Parvinder, good evening. Mane Martha, good evening. Yes, Ria, good evening. Sonia, welcome. Amrita, good evening. Simi, hello, hello Mane, hello all. So, so shall we start? Okay, you all are ready to attend the session? So, I hope I have just addressed almost all the concerns that has been sent to me so far. So, now we are going to move with the discussion. Yes, I have got many gadgets in my hands. See, I am dealing with YouTube, Facebook, all those things. Okay, I feel like you people are not getting bored. Okay, Vipin, thank you for getting me this. And if anything more is there, means please give me. Okay, Rija, good, yes, good evening, Mane. So, we can start our role play sessions now. So, first of all, you can just try the heading like asking about the location of the problem. So, now I will be giving you certain question structures that you can apply in your OET role play. Okay, how to question the location of problem, whether it is pain, some sort of hurts, or soreness, numbness, tingling, whatever it is, whatever the problem may be, we will be I'll be giving you certain good question structures, different question structures where you can use use in your role play to fetch a good score. Okay. So, what is that common term, what is the common statement that we are using to crack where is the pain? Okay, so that will be mostly using. So can you just suggest me some other question structures that you can use to ask for locating the problem? Can you please send me first something? You can type it and send here. Where is the pain? That is that usual term, commonly used, okay, overused, or a cliche we could say like, okay. So the question structure that we use mostly is like, where is the pain? So what else is there? Please let me know through your comments, my dear students. Anything is there means please just tell me. Okay, so the common term that we are using in hi sir, good evening. I am glad to inform you that I have passed my exam. Thank you for all your help and support, Chinnu. I am very happy, Makle. This is what I really consider as a true bliss. Okay, your words are pouring on me like blessings. So when it comes to a teacher, the sort of contentment that he could enjoy or she could enjoy is like good words from students. Always I am very happy that whenever it comes to the future of my students, if it becomes jubilant, if it becomes good, if it becomes blessed, I will be the person who will be enjoying, who will be more happiest. Okay, the happiest man in this world. I feel like I could say that. It is not just like joking. I am saying like I feel like my tears are welling up with welled up with tears. I could say like that. So I am really very happy that you have just got your results. So all my dear, all my wishes and prayers, my blessings for your all your future endeavors. Okay, God bless you, Mane. God bless you, Chinnu. Neetu has sent me that question like, can you locate the pain? Yes. Where is the pain is the most used. Can you locate the pain? Yes. Could you please tell me where do you feel pain? Okay, where do you feel pain? Where is the pain? Could you please tell me where do you feel pain? Okay, all these structures that we can use. Then what else? There are certain good question structures that you will feel more excited, you will feel more interested in, so you can use that. Okay, could you please point out where is the pain actually locating? So that is okay, Mane, I am very happy that you are getting me so many comments. Please do support me by sending this sort of comments, okay, for my questions. Yes, could you please, if you don't mind, would you please tell me where do you feel pain? Okay, in all your question structures you are getting that where and all. Okay, can you please think out of that box, out of that where? If you have got something else means please send me. Okay. Anyway, would you please tell me where do you feel pain? Okay, I am very happy that you people are giving me this sort of support. Okay, well, fine. Now you can start writing. You can please listen to me. And so, where is the pain? Where do you feel pain? And can you locate the pain? Rather than that, here comes the most exciting things, most interesting some statements, some question structures. Where is the sensation? Okay, where is the sensation? Have you ever thought of this? Have you ever imagined such a question structure? Can you just ask to the patient like, well, Mr. Martha, well, Mr. Martin, where is the sensation? Where is the sensation? It can be sensation of any sort or any type. It is, or it can be soreness, it can be soreness, numbness, tingling, whatever it is. You can just ask like, where is the sensation? Okay. Clear, all of you? Where is the pain? Can you locate the pain? Where do you feel pain? Where is the sensation? Okay. Then, can you tell me where it hurts? H-U-R-T-S. Okay. Hurtus. Okay. Can you tell me where it hurts? Can you tell me where it hurts? Reshma has sent me like, tell me about your pain. Okay. Can you tell me where it hurts? Can you tell me where it hurts? H-U-R-T-S, hurts. Okay, hurts. Can you tell me where it hurts? Yes. So, these are something very new, no? Please give me some yes or no. Okay, this I think these are something very new. Okay, so what else is there? Where do you feel sore? Rather than this pain, some soaring sensation is there means we can ask like, where do you feel sore? Where do you feel sore? Okay, where do you feel sore? Or you can ask like, where does it feel sore? Where does it feel sore? Where do you feel sore? Where does it feel sore? You can use either of the structures. Okay. Then what else is there? Yes, I am going to give you another. Which part of your body is affected? Please locate it. You can ask to the patient, like, which part of your body is affected? Which part of your body is affected? Yes, which part? Could you please describe your pain? Maklai, we are just discussing about the location. Okay, you are just using the good question structure, it is correct, Neetu. So, we are asking about the location. Okay. For description and all, for next class I will be giving you question structures, how to describe their problem, how to go for a how to go for collecting details. Okay, describe. Yes, which part of your body is affected? Which part of your body is affected? Yes, Amrita, Neetu and all are responding me very well. Yes, then where do you feel pain? We have already discussed. Can you show where is the pain? We have already discussed. Show me where the pain is. Show me where the pain is. That is, now we, okay, tell me where the pain is. You can ask like, show me where the pain is, tell me where the pain is. Both those structures also you can use. Show me where the pain is, tell me where the pain is. Okay. Okay. So, where is the pain? Where do you feel pain? Then can you locate the pain? Show me where the pain is, tell me where the pain is. Then which part of your body is affected? Then what was there? Okay. So, what else is there? Where is the sensation? A classic thing is like, where is the sensation? Where do you feel sore? Where do you feel numb? Where is it tingling? Okay, tingling, numbness, sensation and all is there. No. Okay, does it hurt anywhere else? Yes, that is a very good question. Okay, Reshma, does it hurt anywhere else? That is a very good question. Does it hurt anywhere else? You can ask like that. Okay, yes. Can you tell me where it hurts? Can you tell me where it hurts? Does it hurt anywhere else? You can ask like this. Where does it hurts? Then where do you feel pain? Where does it feel sore? Okay, which part of your body is affected? Show me where the pain is. Tell me where the pain is. Can you locate the pain? All these are different question structures that you can use to elaborate your questioning. Okay, when it comes to your OET speaking. Okay, you can make use of all these question structures. Hope you are clear so far, my dear students. All are clear? Excuse me. Yes. If it is there, you people are following, means please do get me some sort of agreements like thumbs up, or you can just make some comments. Okay. Shall we move to our role play? So, that is it. Reja, yes, Reja is responding me. Thank you, Mane. Yes. So, that question structures, try to by heart that question structures and you can use it in your role plays today onwards. For your role plays, if you come across some questions that could have this sort of assessing problem means or locating some sort of problem means, you can make use of this question structures. Okay, entirely different, something which is novel, okay, novel, okay, some which is very different. Okay, so those sort of overused cliche phrases could be avoid, question structures could be avoid. Yes, so we'll start. I'll go with the role play. Yes. Yes, now I am going to give you the question on the screen. You can have a look onto that. You can take the screenshots. Please go through that. We will be discussing the role play. Jobin. Yes, the question is there. Yes, please do have a look onto that. After that, I will describe you the question. Hope all have gone through the question. So, now I will discuss you the question. Yes, setting is a pediatrics ward. Okay, pediatric ward is a setting. See, that is what the setting or the place where the role play takes place is pediatrics ward. Next one is role description of a nurse. A 10-year-old boy named Michael has had a tonsillectomy and is due for discharge the next day. Okay. His mother thinks he should stay longer, as she says he is still in severe pain and is less alert. He has fever and looks unwell. He is also having difficulty taking fluids. Tylenol is prescribed for pain and the recovery is expected to take between 10 to 20 days. The mother is very anxious about the child's condition. Okay. So, first task is like always when it comes to your role play, while reading this role play nomine along with the scenario in the sense that conditions which are given. Likewise, the description for a nurse is called a scenario, the conditions which we could apply during the role play. Okay, make sure that after reading once after reading that scenario, try to go through that first task. Okay, here the first task is given like inquire the patient's well-being. Okay. Actually, we are have to take a great care in this role play, like we are not talking with the patient directly. Actually, the patient is Michael, a boy, 10-year-old, had tonsillectomy, due for discharge. The very next day the patient is getting discharged. Now we are talking with the mother, okay. But the child presently is that mother is complaining of fever, less alert, the child is okay. The boy look unwell, okay, boy looks unwell. So the mother feels like discharge is not acceptable for her. So she thinks like the baby boy should have a more longer stay. That is what the mother thinks, like he is having difficulty taking fluid. So pain medication prescribed is Tylenol. Recovery period which is given like 10 to 20 days time will be there. The mother is very anxious about the child's condition. So the mother's mindset is also given directly through the question. So inquire the patient's well-being in the sense not with the patient we are talking, we are asking that well-being, the query with, we are inquiring the things with mother. Okay. So this is a known case, both the mother as well as baby are known to us. Since the mother is not introduced, her name is not introduced at the time of preparation, during the 3 minutes preparation you can confirm that mother's name. Okay. And with that we can continue the role play. Okay. So actually this discussion is between interlocutors playing the role of a mother and the nurse could question the things. Okay. First it's patient's well-being we could ask, reassure the parent about Michael's condition. Okay. So the mother is quite anxious, we can question that anxiety we can take into concern, and reassure, that means explain tonsillectomy, standard procedure. Pain, fever, swallowing difficulty are normal. Okay, so those are the hints which is given there. Address the concern on continuing the hospital stay. The mother would be thinking of a longer stay, but we need to explain that is not necessary. Explain the use of medication and how to continue the administration at home. Okay, Tylenol pain medication, crush the tablet if in case necessary. Okay. Appreciate her enquiry on special precautions. That means pain, temperature, frequent swallowing, everything the patient will be saying, like home health nurse visit we can arrange. Yes, give idea regarding eatables. Eatables means those things the patient could consume, food and drinks. I mean soft, liquid foods, easy to swallow things, okay, cold items can be given. Inform expected recovery period and when to resume schooling. Actually the mother would be so much of thinking about the recovery period and schooling and other activities. So we need to give a clear idea, 10 to 20 days, restrict visitors and friends. Okay. So this is what the question is. Okay. Hope the question is clear to one and all. Yes, all of you, have you gone through the question? It's clear, all of you. Is it clear? The question is, it is what to say, like it is a very simple topic, you can just comfortably you can handle this question. Yes. So if the question is okay, means we will start the discussion soon. Any doubts regarding this question means please point it out. Okay, could pin your suggestion in the comment box. Any suggestions or any queries or any concerns or any doubts regarding the question means Makalai, please do put it in that comment section so that I could have a quick look and I could give you an explanation. Please make it fast. All of you. Yes, any doubts? The question is clear now, all of you, yes, all are giving me the comments like yes, clear. So shall we start the discussion? Okay, we will go for role play discussion. All are ready? Yes? Yes, you all are ready, so that we will go for the discussion. Yes. Yes. Yes, all my dear students. So, we will now we will start the discussion. So, how we can go for a good introduction when it comes to this parent. So, you can collect the parent's name during that 3 minutes preparation. Of course, they are known to us, that is why we are collecting the name. As a known case, we can start this topic. So, what would be the first sort of introduction that we can give, like generally good morning. Suppose we can give this patient's name. So, the bystander's names like Martha, let it be Martha. For all role play I am using Martin and Martha, I know that. So, actually that is the name which is coming to me for the first. Okay, so let it be Martha. If you can give me some other names means, please do suggest me in the comment box. If you want me to try with some other good names means, please do give it me here, so that I will go for that. I will go with that. Any other names, my dear students? Please give it first. If you have got some other names, if you are fed up of this Martha means, you can get me some other things. See, actually me, I am handling with more phones in my hand, Facebook, YouTube, everything. Any other names, please? No names, you people are not giving. Okay, let it be Martha. Okay, yes. Good morning or good afternoon, whatever it is, because time indication is not given there. You can take that particular time of the day. Juna. Okay, so Amrita has given me a name like Juna, so I will consider that. Okay, so she has just given me after taking a Linda, Juna, and her first name is Juna. Neetu, so next time I will take Linda. Now let me take this Juna. Okay, good morning. So this is a we are just going to interact with the mother, the introduction. Okay, good morning or good afternoon, good evening. What time of the day we are attending the exam? Since the time indication is not given anywhere, we can just consider the time of that day, particular time of the day where we are attending the examination. Okay, good morning or good afternoon, Mr. Miss Linda. Okay, Linda, Juna. Okay, good morning, Miss Linda. Twice you can ask like good morning, Miss Linda. I am one of the registered nurses. I will be working with your son. Okay, I will be looking after your son today. You can give an introduction like that. Yes. Okay, good morning or good afternoon or good evening, Miss Juna. Okay, good evening or good afternoon, whatever it is. Good morning. Let us continue with this. Good morning. Good morning, Mrs. Juna. Good morning, Mrs. Juna. I am one of the registered nurses. So if you want means, you can just give the your name also. Okay, otherwise you can just start like one of the registered nurse. I am the nurse working or whatever it is. Okay, good evening or good morning, Miss Juna. I am one of the registered nurses. I am one of the nurses working or I am the working nurse, whatever it is, you can explain your title. Okay, good evening, Miss Juna. I am one of the nurses working. I will be working with you. Okay, I am one of the registered nurses. I will be working with your son. I will be looking after your son today. Okay, so that is what you can give your introduction like. Okay, that is clear now. Good morning, Miss Juna. I am one of the registered nurses. I will be working with your son today. Okay, well, how is Michael feeling? Is everything going on well? It seems you are worried. What happened? So, it seems like anxious, the mother is anxious, so we could question that hint. Okay. Otherwise, you can just start like good morning, Mrs. Juna. I am one of the registered nurses. I will be working with your son today. How is Michael? How is he doing? Okay. So, hope you are ready for discharge. Okay, he has had a tonsillectomy and his discharge is fixed. Okay, what do you think about it? I thought it would be a better idea to discuss about the discharge arrangements. I thought it would be a better idea to discuss about the discharge arrangements. Good morning, Leona. Okay, so you have just given me, today I am taking care of you. How is he doing today? Okay, that is what. Okay, I thought it is a good idea. I thought it would be a better idea to discuss about the discharge arrangements, so that you will feel more comfortable in taking care of him and everything is in place after going home. Okay, so you can just, Neetu has given me an introduction, very good, Mane. Okay, so Neetu has just given me, today I am taking care of your son, how is he doing today? Okay. Yes, that is what the discussion is. I thought it is a better idea. I thought it would be a better idea to talk about the discharge arrangements and care activities after going home. Okay, so that everything is well in place, so that you will be very comfortable in taking care of him after going home. Okay, that is what you can start the introduction. Good morning, Miss Juna. I'm one of the registered nurses. I'll be working with your son. I'll be looking after your son today. How is he doing? Is everything going on well? See, his discharge has been fixed. He has had a tonsillectomy. His discharge has been fixed. I thought it might be a good idea to talk about the discharge arrangements. Okay, so that you will feel more comfortable after going home and everything is well in place. Okay, that is what the introduction that we can have. Yes, you look worried or you look anxious, don't you? So, we are just questioning that anxiety. Yes, you look very anxious, don't you? Yes, you look very worried, don't you? Okay, എന്ത് പറ്റി എന്തെങ്കിലും ആകാംക്ഷയുണ്ടോ നിങ്ങൾക്ക്? Yes, you look very worried. You look worried. Yes, you look anxious. You look concerned, don't you? Okay, so the mother will be saying like, yes nurse, I'm very worried about my son. He has fever and he is having some sort of serious pain. He looks unwell. I think he should stay in this hospital for long for observation. He should stay here in hospital longer for observation. That is what I feel like. Okay. Jobin, you can display the questions in midst. Okay, so you will be getting, for newcomers and fresh joinees, you can have this question. Once in a while, we will be giving you the question. Okay. Yes, so the mother is asking like, nurse, you are correct, I am really not confident now, I am really feeling very anxious because I feel like my son should stay here in hospital for long, for observation. He should stay longer for observation. Okay, so that is what, he looks unwell, he is tired, fever is there, swallowing difficulty is there. Okay, he is tired, everything the mother will be saying. Yes, so now we need to give a better explanation. Okay, reassure about the Michael's condition. We need to explain tonsillectomy, pain, fever, swallowing, everything is normal. Okay, so what we can say, like, we need to make the mother understand. Okay, we need to reassure the mother. So what we can say, like, I see, I can understand why you are feeling this way. I see, I can understand why you are feeling this way. Okay, a tonsillectomy is a standard procedure. It is a small operation. Okay, many children have this operations in their child. Most children have this operation in their childhood. Okay, these things are many normal. Okay, many things are normal after the operation. Yes, like fever and swallowing difficulty and tiredness, all are very common following this surgery, but the next day after operation everything would be normal. Okay, we can say to that mother. Okay. Yes, now the question will be, so we are going to discuss that task detailing. Yes, the mother is expressing her anxiety on that fever and well and all. So we can say, we can reassure the mother like, yeah, I see, I understand, yes, I understand, I know why you are feeling this way, I know why you are feeling this way. Okay, see, you don't have to worry. A tonsillectomy, it is a standard procedure. Okay, it is a small operation. Most children have this in their childhood. Most children, in that sense, if you want, means you can use that, a sort of reassurance we are giving. Okay, most children, many children, you can use like, many children have this operation in their childhood. It depends, many children have this operation in their childhood. Okay, it is a standard procedure, it is a small operation. Okay, after the surgery many things are normal, like fever, swallowing difficulty and See, it is given like fever, pain, swallowing difficulty, all are very common following this surgery. Okay, no worries. After the next day after the operation, everything would get better. Okay, the child will feel better. Every day he will feel a little better. Every day he will feel a little better. Okay, many things are normal after the operation. Many things are normal, like child is experiencing fever, child is having fever, is having swallowing difficulty, and what is that other thing is like pain, fever, swallowing difficulty. Many things are normal after the operation. No worries, after the operation many things are normal, like pain, fever, swallowing difficulty. But the next day after the operation, he will feel better. Everything would get better. Okay, every day he will feel little better. ദിവസത്തിന് അദ്ദേഹം okay ആയിട്ട് വരും. Okay, many things are normal. You don't have to worry. See, for pain, Tylenol has been prescribed. Okay, so for pain, doctor has prescribed Tylenol medications. We are administering the medication, or you can give the medication after going home, so that the pain will come down. And for swallowing difficult, and swallow will be getting better within a few days. Okay, he will feel every day he will feel a little better. Okay, pain, fever. Okay, soon the temperature will come down and he will come out of fever. And for swallow, so it will also get better with time. Okay, swallowing ability he could regain his swallowing ability soon. Okay, swallow will also get better with time. You don't have to worry. Many things are normal. You have to assure the parent like many things are normal after the operation, like pain, fever, swallowing difficulty, but every day he will feel a little better. Things would become better within a few days. Every day he will feel a little better. That thing you can use like, okay, see, for pain you don't have to worry. Tylenol medication has been prescribed. You can give it. Okay, so in hospital we will give it, and after going home you can continue the medication. If he has got swallowing difficulty, you can crush the tablet and give it to him. Okay, if he has got swallowing difficulty, after going home you can crush the tablet and give it to him, so that medication but make sure that the child is taking medication, pain medication every day. Okay, and fever will come down and swallowing will also get better with time. You don't have to worry. Okay, he will feel better soon. These are common reactions following the surgery or operation. Yes, all are getting me? Okay, so the mother is again saying like, I feel like nurse, he should stay. No, there is no need of any hospitalization. It is quite normal to have a discharge following the procedure. Okay, a home care is most necessary. Home care is needed for the surgery. There is no need of any hospital stay or observation. Okay, you can definitely take him back confidently. You can take him back home and can continue his care there. Okay, so again we can say like, as I told, these things are common and every day he will feel a little better. No worries, stay confident. Okay, that is what we need to assure the parent. Yes, all are getting me? If you are getting me, please just give me some thumbs up, or some thumbs up in the sense you can just get me that thumbs up sign. Okay, emojis you can send me. Yes, so you don't have to worry. A longer hospital stay is not at all necessary. These things are quite normal following the surgery. We are just assuring the parent. Okay, so all these signs and symptoms would be normal. Okay, a longer hospital stay is not at all necessary in his case. You can definitely take him back home. Okay, so my dear students, they are responding to me. Thank you. Okay. Yes, so when it comes to the next step, explain the use of medication and how to continue the administration at home. Okay, so I have already discussed that. Well, nurse, tell me about this medication. Okay, so we can just convey the parent. Yes, I know that you are quite confused when it comes to medication. You don't have to worry. We will get you a detailed prescription of whatever medication that he has to continue, that he has to take. We can tell like, yes, I understand. I know you are quite confused about the medication use. You don't have to worry. Here in hospital, we will be giving him the medications. After going home, you will be provided with a detailed prescription. You will be provided with a detailed prescription so that you can have a look. Okay, you can refer that and can administer the medication. See, pain medication has been given and there will be other prescriptions too. Okay, make sure that the child is continuing pain medication. It is very important. Make sure that the child is continuing pain medication. If he has got some trouble with his swallowing, try to crush the tablet and give it to him, but make sure that child is continuing the course. Never ever skip the dose. Okay, there will be other prescriptions too before your discharge. We'll make sure that all this will fill the prescriptions before your discharge. Okay, so you don't have to go to the chemist. We will get the prescriptions filled for you. You can say like, so don't worry, before your discharge you will get the prescriptions filled for you, so you don't have to go to the pharmacy or chemist. Okay, and will explain you each and every dosage. Moreover, you will be given detailed prescription for your reference. So don't worry about the medication. Ensure that the child is continuing his pain medication and other medicines. Okay, never ever allow him to skip the dose. Okay, in case if he is having some swallowing difficulty, Ms. Martha, try to crush the tablets and give it to him. So that is what you can give to that, you can explain to that mother. Yes. Can give the question. Inmates, so many are newly joining, so if you want the question means we will be giving you. I would suggest you to crush the medicine. Yes, Neetu has sent me a statement. Yes, the question will be displayed once more, so that we will go for the next task. Okay, hope this section is clear so far. Yes, what is the other question which is given like, other task is like? Yes, the other task which is given like, answer her enquiry on special precautions. Okay, that is what. Yes, Jovin. So those who haven't, who have recently joined, you can take that, okay, that screenshot. Okay. Yes. So the next task which is given like, appreciate her enquiry on special precautions. Obviously, the mother would be asking like, nurse, are there any special precautions? Do I need to take care of something in particular? Please tell me whether I need to go for some, whether I need to keep some special precautions for my child. So then we have to inform the mother regarding the special precautions. What we can, yes, I appreciate your concern. I know you are very concerned. I appreciate that. Well, there are certain precautions that you must take care of. There are certain precautions that you must follow or that you must take care of. First and foremost is like medicines. As I have already told Miss Giuna or Martha, whoever it is, make sure that the child is continuing his medicines. Okay, never ever allow him to skip the medication, especially the pain ones. Okay, and in case if the pain worsens, okay, observe the child properly and you can bring him here. Okay, in case if the pain worsens, do not delay, bring him back to the hospital immediately. And next is temperature. Okay, the question is like temperature you have to take care of. See, pain, temperature, frequent swallowing. So make sure that the child is continuing. Yes, there are certain precautions that you need to follow or that you must take care of. Okay. That you must follow. First and foremost is regarding medications. Make sure that the child is continuing his dose medication. He has to complete the course. Never ever allow him to skip the medications. Okay. Next is pain. You have to have a close watch over the signs like pain, fever and swallowing. Make sure that if the child, okay, in case if the pain worsens, observe the child properly and bring him back immediately. Okay, and try to ensure his temperature, try to check his temperature once in every 4 hours. Try to check his temperature once in every 4 hours. In case if you observe some variation, you can report it to the doctor immediately. Okay, contact to the doctor immediately. And finally, if the child experiences frequent swallowing, if you observe frequent swallowing, okay, in case if you observe frequent swallowing, that should be a sign of wound swelling and bleeding. Okay, never delay, get him back to the hospital immediately. Well, there are certain precautions that you need to take, Miss Martha, Miss Juna. First and foremost, medications, make sure that the child is continuing the course. Never ever allow him to skip the medicines. Okay, it has to be followed. Okay, it has to be strictly followed. Next, there are certain signs and symptoms that you have to take care of, that you must take care of. First is pain. Okay, observe for pain and other symptoms. In case if the pain worsens, or when it comes to temperature, try to check the temperature once in every 4 hours. If you notice an elevated temperature, a constant elevated temperature, and if you observe frequent swallowing, that could be a warning sign of wound swelling and bleeding. Okay, in that case, never delay. If you observe these signs and symptoms, any of the signs and symptoms, or if you observe the signs and symptoms, try to get back to the hospital immediately. Get your son back to the hospital immediately. Okay, these are certain signs and symptoms that you must have a close watch, Martha, Juna. Okay, so this is how we are going to. Okay, and yes, Neetu has just given me like, Haji, hello Mane. Neetu has given provide upright position while feeding in order to prevent aspiration. Okay, that can also be added. See, that point is not given there. In case if you feel like you are having extra time, please do put that suggestion also. Provide upright position while feeding for aspiration. And when it comes to, okay, so you don't have to worry. I will arrange a home health nurse to come and visit your son. So she will regularly assess the wound and will do the needful. Okay, and you don't have to worry. I will arrange, I'll fix a home nurse visit to your son. She will come and assess your boy, and she will observe the wound and will do the needful. Okay, she'll be there to observe your child and will do the needful. She will be regularly coming to observe the child and his wound, and in case if something is needed, she will do the needful. Okay, don't worry about that. So home visit is also. So Aji has got 380. I'm very happy, Mane. Very happy that you are just getting good scores. I'm very happy. So all the best for your future endeavors. Okay. That is what. And regarding food, make sure that you are giving him some soft and semi-solid. Okay, soft, semi-solid and liquid diets. Mostly cold foods are preferable. Okay, so you can, yes, Miss Juna, make sure that you have to take a great care when it comes to his diet. Make him eat some cold foods. Okay, soft, liquid and easy to swallow food should be given. Okay, make sure that the food is soft, easy to swallow. You can give him liquid foods, cold foods, soft, easy to swallow and liquid foods. Okay, try to give him with soft, liquid, easy to swallow foods. Okay, mostly cold items are preferred. Ice creams would be better. You can give him cold fruits, juices and cold fluids, juices and drinks. Ice creams would be better. Okay, he will be delighted. You can use those sort of dialogues. Ice creams would be better. He would be delighted. That means child will get happy. Okay, ice creams are better. He would be delighted. You can use that sentence if you want means. Okay, so if you are using proper intonation, Mane, you can use all those things. Ice creams would be better. You can give him that. Okay, try to give him cold foods, cold fluids, drinks, juices. Ice creams would be better. So that prevents wound swelling and promotes easy healing. So make sure that foods are given in this manner as advised. Okay, foods are given as instructed. Okay, make sure that the foods are administered as instructed. Okay, that is the thing. Yes, okay, then they will be asking like, nurse, my son's friends and all are visiting him or all are eagerly waiting for him when he can resume his schoolings. Okay, can I send him to school? What about his physical activities, his play activities? What about his activities of daily living and all? My child, I'm really very worried about that, nurse. The mother will be asking. So we can say like, yes, I understand that you're very much concerned about your son. Same as Juna. Generally, it takes 10 to 20 days for his recovery. Generally, it takes 10 to 20 days for his recovery. Okay. And during this time, the child's immunity will be very less. Okay. There will be compromise in his immunity. At this time, the child will be more prone for infection, or the child will be susceptible, child is susceptible for infection. Okay. His immune system is not good as before. Okay. See, Ms. Juna, it may take 10 to 20 days for his complete recovery. During this time, his immune system would not be good as before. Okay. Immune system would be compromised. Okay. It won't be good as before. So, you have to take a great care. So, you have to take a great care. Okay. So, it's susceptible for infection. Risk of infection is more in this condition. So, it is better to make him stay away from visitors. Avoid crowds, stay away from visitors. Okay. Minimize the number of visitors. Okay. It would be a better idea to keep him away from friends, relatives and other crowds. Okay. As the child is highly susceptible for infection, as his immune system is not as good as before, it is a better idea. It is better to make him away. Okay, it is better to make him stay away from crowds, friends and visitors. Okay. After 10 to 20 days, he can freely mingle with his friends and relatives. Okay. At that time, he can resume his schoolings. And for the sake of safety, it would be a better idea to get consulted by the doctor. It would be a better idea to consult the doctor. Okay, that is what we can just like. And for the sake of safety, it would be a better idea to consult the doctor. Okay, you can do like that. So, this is the way we are explaining the things to the patient. 10 to 20 days, try to make him stay away from crowds. His immune system won't be good as before. Okay, it may take some time to develop immunity. Okay, he will be highly susceptible. The risk of infection is more, highly susceptible for infection. So, it would be a better idea. It is better to make him stay away from crowds, visitors and friends. Okay, and he can resume his schoolings after this 10 to 20 days. And for the sake of safety, before that, it would be a better idea to consult the doctor. How about that? Okay. So, they will be saying like, definitely nurse, I will just definitely follow your words. I will definitely follow your words. Great. Great, Ms. Martha. So, if you follow this instructions advice, definitely you can ensure a speedy recovery for your son. He will be all right for sure soon. Okay. He will be all right for sure soon. Okay. Is there anything else that you would like to ask or discuss? Is there anything else that you would like to ask or discuss? So, the mother will be saying like, no, nurse, I feel like more informed, thank you. So, now you stay with your son, make him feel more comfortable and relaxed. Okay. And in case if you need me, just get me the bus. Just get me the bus. Okay. I will be here around. You can say like that. Okay. So, is there anything else that you would like to ask or discuss? No, nurse, thank you for being here. Okay, glad to hear that. Now, Ms. Juna, please stay with your child, make him feel more comfortable and relax. In case if you need me, just get me the bus. I will be here around. You can say like that. Just get me the bus. Bus or bus. Just get me the bus. B-U-double-Z. Bus. I'll be here around. That's it. With that, we are finishing the role play. Here comes an end of this role play discussion. So, I hope it's clear. My dear students, it's clear. Any doubts or queries, please tell me. So, that is what that comes. Here comes an end of this role play, today's session. It is 5:59. So, it's time for me to wind up the session. Hope the session was useful for you all. So, you have got certain good sentence structures and all, you can use this and make sure that you are using proper intonation to deliver these dialogues. If you use proper intonation, organization and all, you will be definitely getting, you'll be having an A band for your speaking. Okay. So, that is what I feel like. So, it's clear. Okay, Maklai, any suggestions or things means you can just contact our wing, and in case if you wish to take admission, please to contact our officers. The numbers will be pinned there. You can make use of that contact numbers. Okay. So, anyway, thank you for extending me your support throughout this presentation. So, by next week, we will be again here on this virtual platform with another interesting topic, exciting topic for you. Okay, till then take care. God bless you all. Bye.